Welcome to ETMC TV and this informative presentation by Dr. Adam Newman, board-certified OBGYN at the ETMC First Physicians Obstetrics Gynecology Clinic in Jacksonville. Dr. Newman will discuss menopause and other women's health topics. Thank you for choosing ETMC TV.
Menopause really is a process. It's not a day that it just happens. It can be very, very gradual for some women, almost to the point of not having a great deal of symptoms. Certainly the most common being irregular cycles. Their cycles may get closer together, further apart. They may get heavier, lighter, more painful, less painful. Hot flashes are a very common complaint as women get closer to 50-ish. Going along with that, some of the dryness and problems with their bladder, especially if they've had kids. And there's a whole series of really non-specific but really can be very troubling complaints that some women get. They will really describe it very simply as, I just don't feel like me. I'm not sleeping well, I just don't feel like I think as clearly. They're very non-specific, but in some ways they're almost as troubling because they just sneak up on them. They don't just have a switch that goes off. That historically has been estrogen in some form, whether by mouth, in a patch. There's different vaginal preparations, creams, rings. Very appropriate for most women, but there's clearly a subset of women it does not work well for, or there's reasons not to take. History of blood clots, any estrogen-sensitive tumors. Some women have significant reaction as far as their blood pressure goes. So for the women that can't or choose not to take anything hormonal, there are other second-line medications. Do they work as well and as consistently? No. Do they work better than nothing? Clearly, yes. Bleeding issues, some of the vaginal dryness issues, discomfort with intercourse, some bladder issues, oftentimes need to be addressed on a more surgical level, but most of the time can be addressed hormonally. And the nice thing about it is, if they're not having other systemic symptoms, if they're not having the hot flashes and other issues involved, we can target the treatment really just vaginally into the bladder and get a lot of relief for some of the symptoms that women have. And while historically hysterectomy has been a very overutilized surgery, it remains very appropriate for some women, but there are clearly a great many non-surgical or very minimally invasive surgical treatments for those complaints that allow women to come in and go home the same day. They can literally go to work the same day they come in. It's called endometrial ablation, which basically means destruction of the lining of the uterus, because that's the tissue that does the bleeding. There are certain situations that endometrial ablation is simply not appropriate for. But in my experience, the vast majority of women can be treated as an outpatient with a minimally invasive surgery. Again, in some women, a hysterectomy is a very appropriate surgery. But in the most uncomplicated surgery, you're still having surgery. So if you can avoid that, that's a win for everybody. Ovarian cancer is uniquely challenging in OBGYN because it really doesn't have a whole lot of very specific early signs. It doesn't have the equivalent of a pap smear that we have for cervical cancer for early detection. So it can be very, very challenging because it often presents late. In situations where there's a clear family history, there are some blood tests that can be done to see whether or not that patient has a genetic predisposition to some of those issues. But doing that testing in conjunction with counseling with a genetic counselor who can really go into a lot of some of that detail with the patient allows us to come to a really better plan for them. There's actually some very new compelling data that suggests the tube itself may play a role in the development of early ovarian cancers. So for women that, for instance, are having their tubes tied for contraception, there's a growing interest in, rather than simply sealing the tube off, actually removing it as a means of potentially preventing ovarian cancer in the future. There's a great number of non-surgical, non-terribly interventional options out there, and it's just a matter of coming in to talk about them.
Adam Newman, MD, FACOG, is a board-certified OBGYN and a fellow in American Congress of Obstetricians and Gynecologists. He practices at the ETMC First Physicians Obstetrics Gynecology Clinic at 203 Nacogdoches Street in Jacksonville. Call 903-541-5396 for an appointment. Dr. Newman received his Doctor of Medicine degree at New York University School of Medicine in Manhattan and completed his internship and residency at the University of Arizona Health Sciences Center in Tucson.